most high performing systems in your head right now. Describe what separates them, what health systems that you deal with, what separates them, what are some of the activities they do, what are some of the things that you look at and you go, that is what separates them, that's what makes them leaders in the field.
From a decision support perspective, I'd say,
yes.
Okay. So from that perspective, I'd say they have a process. They have a process that says, we know we need to continue iterating through this. It's not you fix it and it's done. So they have ongoing.
There's a maintenance and a governance that's sort of set up when you put it in to say, hey, this isn't we built the house, we're done. It's a constant iterative process.
Yes. So there's that iteration, knowing we need to review and refine in an ongoing basis. Something that was working yesterday may not be working today for any number of reasons. The system is always changing. The other thing is an awareness that there's only so much space for decision support. So again, that idea that something that was put in 2 years ago may not be providing the value or may not be necessary or may not be as important today for something new that you want to put in the system. So I'd say there's that awareness as well. And that governance piece, I cannot overstate the value of that because, as we mentioned before, perception of the importance of different alerts varies by discipline and by specialty. And so having that conversation, there's a natural friction between physicians and pharmacists, nurses, even respiratory therapists or other clinicians in the space. So knowing who you're targeting with that alert, having the conversation, having the right folks at the table to weigh in on the decision making.
So governance, what is it? What is a good makeup of governance? I mean, I assume there's a process that is apparent to people of how to escalate a challenge and those kind of things. But then there's a group of people. What kind of governance processes have you seen and who's a part of them that really works?
You have to have your CMIO, absolutely. You have to have physicians at the table. Pharmacy needs to be there. Nursing or nursing informatics needs to be at the table at a minimum. I would say that's for an overarching governance structure that we've seen. Likely need some analysts or folks that are doing some of the work with decision support there. When you get into medication alerts, the high performing ones tend to have physician stakeholders engaged with pharmacy. Now, some pharmacy leads the charge and it works well, but for the most part, it's good to have physician input in there. And that tends to require more of a subcommittee because it's a little more digging into the details with medication alerts. There's a lot packed into that type of decision support and usually requires, because it's more of a direct safety check versus identifying a care gap, it requires a little more sleuthing to make sure you're not going to unintentionally create a safety issue. So I would say typically you'll see kind of a subgroup that digs into that and can bring their findings up to the larger committee.